Hi, everybody. It's Leila, Health Education Manager here at AiArthritis, and I am here to report back on a few sessions about IgG4-RD. We wanted to do a quick IgG4-RD dedicated debrief to talk a little bit more about this new disease that has been recently discovered in the past few years, and a lot more research has been done about it this year and presented at ACR. And from everything that we see so far, it does look like it may end up being under our AI arthritis disease umbrella in the next few years. Right now, it's classified as immune mediated and not necessarily an autoimmune or autoinflammatory disease yet. But some of the things that they are discovering about the disease does lead towards thinking that it may be an autoimmune disease. So I'm going to talk a little bit about some of the different events that have happened around IgG4-RD, so the discoveries that they've made, some of the research. And this is going to be covering a few different sessions. Some of the abstracts that they presented at ACR this year on IgG4 were also more about like how people were being diagnosed with it and reporting back on clinical findings, like in clinic on diagnosing and who the most common patients are and all these different things as well. Not only will we do this dedicated video for IgG4-RD, but there will also be a few blog posts coming out about the different abstracts of IgG4-RD as well as we, as a rheumatology community, find out more about this disease. And so right now, it's still really hard to diagnose IgG4-RD because of how different the symptoms are for each different patient. It affects so many different organs and organ systems that it just makes it really hard and sometimes misleading to find the actual diagnosis. You land on checking for cancer and other autoimmune diseases, and it just gets really complicated. And so, on average, it's said that patients usually see four different specialists before landing with someone who even recognizes their symptoms as possibly being IgG4-RD. And many patients also undergo unnecessary surgeries, including organ removal, even before they get an official diagnosis. And although the disease is called IgG4 related disease, the blood serums of IgG4 in blood is not reliable to diagnose patients. We're finding that elevated IgG4 is related to what's happening in the immune system, but doesn't actually correlate to how aggressive the disease is or how much damage it's doing. And sometimes up to 40% of patients can have normal IgG4 serum levels. So it's really unreliable to help make a diagnosis. And with some expert advice, this is what they're calling the diagnosis triad. And taking imaging and seeing patterns, there can be sausage shaped pancreas, tissue swelling, and homogeneous enhancements. You can do a biopsy with IgG4 plasma cells and seeing some of the fibrosis that happens in this disease. And you can see clinical pattern across the different organs that there's fibrosis going on and on these different organs like the pancreas, the kidney, the liver. And fibrosis is just hardening cells that are across the organ that make it hard for the organ to function. And the biggest clinical message here was doctors should try and think of IgG4 a little bit earlier when some symptoms cluster across multiple organs. So that's one of the biggest things is seeing the same symptoms across several different organs that can really lead to an IgG4 diagnosis. And basically, they're understanding now what really drives IgG4-RD. The IgG4 itself is not the problem. It's, of course, interaction between T and B cells. And that is very common in other diseases like lupus, Sjogren's, and other AI arthritis diseases, where it's more of the B cells and the T cells that are causing the issues. And specifically in IgG4, we see specific B cells called double negative B cells that are actually the ones that are infiltrating the tissues and behave abnormally. And they are clonally expanded, which means that the immune system is repeatedly triggered by something specific in the T cells. And basically, it's showing that the fibrosis that's happening is driven by the T cells that are from these abnormal B cells, and that's what is sustaining the disease. And it's very similar to systemic sclerosis in that way, or scleroderma. And what we're seeing is that the chronic inflammation and IgG4-RD is from B cell activation, T cell expansion, and T cell involvement. And then that directly produces cytokines that cause fibrosis. And that means it forms dense masses, mimics tumors, causes organ dysfunction, and it can progress pretty fast, even if symptoms seem mild. And so they are starting to take a look at some of the genetics that may be influencing IgG4-RD. And they found a few specific cells that can be found in those who have IgG4-RD, one of them being called FCGR2B, which is an immune regulatory receptor. And there are different studies going on where they are trying to sequence the whole exome of people who live with these diseases to try and find the variants in their genes. And what we're really seeing is that IgG4 likely has a genetic component to it, genetic susceptibility, plus an environmental trigger that causes the disease. So that's very similar to what an autoimmune disease is as well. They're also doing studies to see if there's any clues to IgG4-RD in patients' microbiomes, or like their flora in their system that helps digest food and things like that. And what they're seeing is there's a lower amount of a specific kind of cell and higher amounts of another specific kind of cell that's very often seen in systemic sclerosis as well. So there has not really been a specific microbiome that's identified yet. The issues with the microbiome does seem relevant to what's going on with IgG4, so they're going to continue doing studies to see what they can find. And what they're finding, especially with the new medications that are on the market now, is that B cell depletion works, which we knew before because patients were using rituximab in the meantime. But what we're seeing now is that specific CD19 targeted medications. CD19 is a specific antigen that's found on B cells. So basically, the medicine will find the specific B cells that have that CD19 identifier on it. And removing those B cells in particular has been very helpful to help control disease. And what we're finding is that this hits earlier B cells and plasmablasts rather than the mature B cells that rituximab already depletes. And it's a little bit more targeted. Patients are seeing that an 87% reduction in flare risk within a year. There's a good safety profile, lower infection risk than expected for heavy immunosuppression. And it really does look like CD19 is the best therapy for these patients. And it's also being studied to see if it can help in other diseases as well, like lupus. And so that's really cool to see how different medications can be used for different diseases if they have the same mechanisms of what's causing the issues in those diseases. That's really cool to see. And lastly, just a few last minute takeaways for patients. Just really seeing that early symptoms don't often look connected, which is very similar in AiArthritis diseases as well. But seeing the multi organ involvement is really important, especially if you see salivary glands, pancreas, and lymph nodes all together. Those are really big signs of IgG4-RD. So for patients and clinicians to be able to see those three symptoms and think IgG4-RD. Again, normal IgG4 levels do not rule out IgG4-RD. These IgG4 serum levels are not very helpful in diagnosis. Biopsies are still very essential when it comes to confirmation of this disease because imaging cannot really see the actual fibrosis as well as a biopsy can. And making sure to ask about B cell targeted therapy, even CD19 specific therapy, especially if there's many relapses that a patient is going through, multi organs are involved, there's steroid dependence, and significant fibrosis. And of course, like all of our diseases, tracking symptoms is very important, but specifically for IgG4, tracking symptoms across the different organ systems. Again, it's often misdiagnosed as cancer, sarcoidosis, systemic sclerosis, Sjogren's, a lot of these different diseases. Sometimes it's hard to diagnose our 23 AI arthritis diseases, and even more so for IgG4 if it's being confused with these diseases and it's hard to find all of the different related symptoms that lead to this actual disease. And even more so because it's so new. So a lot of doctors are still becoming familiar with the disease. And so that's why we are bringing so much awareness because we want these patients to be able to get the treatment that they deserve. And it has a tendency to become very emergent very fast when it comes to IgG4. RD. That is my information that I have for you on IgG4-RD, hopefully summed up in a really good educational way for patients to understand. And yeah, if you have any questions, feel free to leave a comment on this video and we'll talk to you soon. Thank you for joining us for Go With Us 2025 to ACR.